Hi, my name is Veronica Arana, and I will be taking you through the remainder of the course on opioid misuse and abuse prevention for post-surgery patients. So what are the treatments for opioid misuse and addiction? Treatment is different for each person, and the goal of treatment is to basically get you off the drugs. So when you stop taking the medication or stop using the opioids, you'll have a number of different symptoms. Some of those may include nausea. They could include vomiting, abdominal pain, and anxiety. And these reactions are called withdrawal. So medications for treatment. Your doctor can prescribe certain medications to help relieve your withdrawal symptoms when you stop using opioids. One of the first ones it's called bupropion, which suppresses and reduces cravings for opioids. Methadone, which reduces opioid cravings and withdrawal and blocks the effects of opioids. And naltrexone, which blocks the euphoric and sedative effects of opioids and prevents the feeling of euphoria. So fighting addiction. The first step in breaking addiction is to realize that you control your own behavior. So these steps will help you fight your addiction. So you have to make a commitment to change. So you're in control and you have to commit and follow through with this. So you have to fight addiction. Getting help from your doctor can be your greatest ally. So you definitely want to use him. And then you can get support. So there are multiple organizations out there that will help you quit. They can give you the tools and support that you need. And then also asking your family and friends. So treatment for opioid misuse and addiction include medicines that we just spoke about, counseling and behavioral therapies. We'll go a little bit through that shortly. Medication-assisted therapy, and then inpatient treatment or partial hospitalization, which is like detox. So you'd be in a facility that is managed and cared for by professionals like doctors, nurses. So the first activity is treatment and recovery. So what we're going to do is we're going to pass out a worksheet. And on those worksheets, we're going to ask you to identify the 3 treatment medications for opioid addiction. The second activity is list 5 treatments and recovery options in writing. So you can also use a worksheet that we also gave you. And in that worksheet, it also talks about different virtual organizations like Narcotics Anonymous that will give you the ability to, since because of COVID, get on there and talk to people globally that are maybe going to similar situations. And there are other support groups on that worksheet that you can use for this activity. So what are universal triggers? So universal triggers are defined as stimuli associated with addictive substances that can trigger the urge to use opioids or just take opioids. Continuing friendships with users, extreme emotional states like depression, obviously frustration and anxiety, those provoke those feelings of wanting or the urges to want to use. Living conditions, so returning to dysfunctional or isolated living situations. Social settings, so events and parties that may trigger you wanting to use because there are alcohol and drugs involved. And then deep-seated childhood traumas, so if you were involved in child abuse, those can also be triggers. So the next activity is, can you list 5 universal triggers? So list 5 universal triggers for opioid relapse. And there's a worksheet being passed around. So what is stress management? The use of specific techniques, strategies, or programs such as relaxation training, anticipation of stress reactions, breathing techniques for dealing with stress-induced situations, and the state of being stressed. So as you can see our little image here, stress management can be taken care of by exercise, meditation, yoga, taking a walk into nature, music therapy, and time management. Key pain and stress management strategies, pain-relieving medications or medicines, physical therapies, psychological therapies, mind and body techniques, occupational therapy, and community support groups. So there are also coping skills that you can use or techniques that you can use. So these are the 4 A's. The first one is to avoid. So rearranging your surroundings, taking control of your surroundings, avoiding people that bother you, and learning to say no. There are situations where you may not be able to avoid people or things, so you can alter your situation. So respectfully asking others to change their behaviors, using I statements like, I feel frustrated when you invite me over to events or parties where you know there'll be drugs and alcohol. And then accept. So accept the way things are. Adapt is the next one. So changing your standards or expectations. Thinking you can't cope is one of the greatest stressors. So you may want to rethink that and start using positive thinking, or stopping those negative thoughts. Replaying stressful situations. Learning to see the big picture and saying, is this really going to be important for me in a year, in 5 years? So the next activity is avoiding stressors. What are the steps people can use to avoid stressors? List 5 steps people can take to manage or avoid stress. Cognitive behavioral therapies include progressive muscle relaxation. So tensing a muscle group and then releasing that muscle group and seeing how that feels. Autogenic training, so imagining calm, relaxing environments and comforting bodily sensations. So as you can see, the lady in the picture, she's kind of laying down and just probably doing some breathing techniques and imagining maybe a beach. All right, cognitive behavioral therapies continue. So positive affirmations, I am strong enough to handle this pain. Repeating that over and over, or using affirmations like that. Meditation, so it's similar to self-hypnosis, but basically there's all kinds of different types of meditations, including mindfulness, concentration, transcendental meditation, and several types of movement meditations. So find one that works for you. Breathing techniques, so slow pattern abdominal breathing. So we're going to try one. We're going to try deep breathing, and so what we're going to do is a 2x breath. So what I want you all to do is take a deep breath, and then for 2 seconds, and then you're going to release it for 4 seconds. So you're going to take a deep breath through your nose, exhale through your mouth. Ready? So we're going to go, ready? And exhale for 4. One more time. I'm sure everybody feels much better. So physical activities, so finding the appropriate level of activity or sport that you like. So obviously if you don't run, you don't want to say, I'm going to run 5 miles. You probably want to take a walk in the park or play some type of sport like tennis or whatever you prefer, basketball. Relapse prevention techniques, examining the events leading up to the increased pain. So if you broke your shoulder or your knee, you want to find out what leads up to the pain. Is there something that you can maybe identify that causes, so that you can prevent future pain? And then finally, operant behavioral therapies. So this therapy reinforces healthy behavior and ignores pain behavior. Biofeedback, so they're devices that measure heart rate and muscle tension. And then there's hypnosis, a state of selective attention. So as you can see the picture, it kind of like hypnotizes you. Additional techniques, cold and heat packs, physical therapy and occupational therapy, yoga and tai chi, music therapy, and therapeutic massage. So the next activity is we're going to demonstrate 3 different stress release techniques with a partner. And then we're going to describe 5 coping skills for opioid addiction, and that's going to be done on a worksheet. So lastly, I'm not telling you that it's going to be easy. I'm telling you it's going to be worth it. That's an anonymous quote. And finally, we have a worksheet that's going to be passed out with 10 questions, and once you turn that in, you'll get your exit ticket. Thank you so much for your time. Have a great evening.